Eddie, let's talk about poverty. Let's talk about Dorothy just talked about Chicago. This is hitting Detroit now. It's hitting New Orleans, and some people think that's because Mardi Gras was allowed to go along. But a lot of people said it may be because New Orleans has a whole lot of poor people who continue to not have great access to medical care, who live in close quarters. The fact is, this may be our one opportunity in 15 years to rethink poverty and the fact that being poor isn't your fault, and you shouldn't have to not get health care or not get treatment or not be able to isolate yourself because you don't have insurance if you don't have a job.
You know, Ali, that's absolutely right. Look, there are 41 million Americans who live below the federal poverty level. There are 143 million Americans who are income insecure. That is, they're either poor or low income. And so we know that poverty and inequality are multipliers, right, for the transmission and in some ways for the mortality of everyone, right? And so part of what we have to do is begin to challenge the way in which we have framed poverty in this country. In the last segment, you talked about for 40 years, we have had a discourse or an ideology that has in some ways demonized big government. But for 40 years, we've also had an ideology, Ali, that has demonized poor people. When we go back to Ronald Reagan's presidency, we know that poverty increased by 2.2 million Americans during his first year. We know he attacked welfare. We know he attacked food stamps. We know very clearly the rhetoric around poor people, that poor people are poor because they aren't doing what they're supposed to do. And we've seen over the course of these decades a systematic further marginalization of the most vulnerable. So part of what we need, and we heard this with Dr. King in 1967, and we hear it with Reverend Barber and the Poor People's Campaign today, is that we need a transvaluation of values. We need to change how we think of the common good. Otherwise, we're going to see disaster capitalism. We're going to see those folks who have already experienced the disaster of American inequality deepen in their vulnerability and their precarity precisely because of this disease.